Very short question. Right, so if you have read and understood, considering a clinical examination session, kindly begin.
I'll enter the room. I'll wash my hands, and then I'll introduce myself. Hello, I'm Dr. Karma, one of the exam candidate. Today I've been asked to examine your shoulder, which will involve looking, feeling, and moving your shoulders. Before I begin, may I confirm your name and age, please?
I'm Samantha, 23 years old.
Thank you, Samantha. So before we begin, do you have any pain at the moment?
No, negligible.
Okay,
Continue,
thank you. So I'll need you to remove your gown. I'll need her to expose the shoulders.
Yes.
And the upper arm. Then Samantha, I'll begin by looking. So looking at your shoulders, can you stand for me?
Yes.
I'll ask her to stand, and then I'll examine. I'll inspect from the front, from the side, and from the back of both the shoulders. I'll look for any scar, any swelling, any deformity, any muscle wasting. See if she is on any arm sling. Then Samantha, I'll begin to feel your shoulders and the bones. I hope you have no pain at the moment.
Yes.
Okay. So I'll feel for temperature on with the dorsum of the hands on both the sides, and I'll feel for tenderness. I'll begin with the sternoclavicular joint. Then I'll palpate the clavicle, and laterally I'll go and palpate the acromioclavicular joint. Then I'll palpate the coracoid process. Then I'll go and palpate the greater tuberosity of the humerus. Then I'll go behind, and then I'll palpate the spinous process of the scapula and the scapular borders. Then I'll go to our hand. Then now, Samantha, I'll check your pulse. I'll check the radial pulse and the brachial pulse. Samantha, since you said you have no pain, now I'll need you to do certain movements for me. I'll ask her to, I'll show her the movements. I'll demonstrate. I'll ask her to, I'll ask her to move her hands straight in front and up as far as she can go to see the up as far as she can go, and then down back as far as she can go, and then I'll ask her to abduct, move the arms away from her body along the scapular plane as far as she can go over the head, and then bring it back in front of her trunk, in front of her body as far as she can go to see the flexion, abduction and adduction. Then I will ask her to flex her elbow and then do the internal rotation and external rotation. That's the active movement. Now I'll ask her to keep her shoulders and elbows relaxed. Then I'll do some movements for her. And here I'll abduct the shoulder, and then as far as she can go, and then I'll ask her to hold it, and then slowly release it to see the drop test. And I'll ask her to push I'll ask her to flex the elbow and then push it against resistance. I'll push inside, and I'll ask her not to push. I'll ask her not to let me push inside against resistance. And I'll also ask her to push against my hand in abduction. Then now, Samantha, I'm going to do some special movements. So can you raise your hand in front and at an angle? I'll do the empty can test, whereby I'll ask her to raise her arm straight in front at an angle with the thumb pointing to the floor. And then I'll put pressure on from above, and I'll ask her not to let me push down. Then see for any pain. And I'll ask her to do the Hornblower's test, where I'll check for, I'll ask her to abduct the arm at 90 degree, and then also flex the elbow at 90 degree, and then push backward against resistance. Then I'll do the Gerber lift-off test for subscapularis, whereby she will be keeping her arm on the back, and then push with her palm against my hand. Now, Samantha, I'm going to check some sensation. I'll check sensory sensation of the axillary nerve on the lateral aspect of the deltoid muscle. I'll first of all I'll make her feel whether she can feel this on her chest. So this is how you're going to feel the cotton. Then I will ask her if she can feel on the close her eyes, and then if she can feel on both the sides. Now I'll ask her to push her hands both the hands against the wall, and then I'll check for the long thoracic nerve. I'll check for the serratus anterior muscle.
Yes.
Yes.
Considering, yes.
Samantha, I'm done with examination. You may dress now. Thank you.
Yes. Can you present your examination?
To complete my examination, I would like to examine the cervical spine, the elbow joint, and a complete neurovascular examination of the upper limb.
Yes.
So today I've examined Samantha, 23 years old swimmer, who came with a complaint of ball shoulder, but more on the right side. On inspection, there was no swelling or any deformity, but I found that she had a tender shoulder joint on the right side.
Yes.
And the range of movement was restricted. I'm slightly restricted, and she had pain on abduction from 60 degree to 120 degree.
Yes.
And which means there's a
test was positive?
Yes, subacromial impingement.
Okay.
Which means
so
that and the empty can test was also positive.
Very good. Yes, this is very important to tell. So then what were your provisional diagnosis?
My provisional diagnosis is subacromial impingement syndrome of the right shoulder.
Very good. Yes. How would you confirm your diagnosis?
To confirm my diagnosis, I will do a X-ray or MRI of the shoulder joint.
Okay. Why X-ray? What would you find in X-ray?
X-ray, but specifically I want to do MRI, but yes. X-ray to rule out any bony abnormality, ma'am.
Okay. What are the management or what are the treatment options that you can offer to the patient?
Treatment option, initially I'll begin with the painkiller. I'll treat her pain, then I will advise her some exercises.
Okay.
Then if this conservative treatment doesn't help, then I will also go for steroid intralesional steroid injections.
Okay. If that fails?
If that fails, then I'll go for surgery, ma'am.
What is the surgical option that you can offer this lady? Okay, one last question. When do you think she will be fit to swim again? Because she is a professional swimmer. And when do you think she would be fit again to swim?
I have to.
Sorry? Your voice got disappeared.